sponsored by the Carpal Rx. If you have carpal tunnel syndrome, then you probably already find it very difficult to work or even to use your hands. Your symptoms most likely include hand and finger pain, numbness, and tingling. Of all the therapies people use to treat their carpal tunnel syndrome, few are as controversial as acupuncture. The reason stems from the fact that acupuncture doesn't always work in everybody. It's better than nothing at all, but the effects don't last very long. Acupuncture works by blocking pain and reducing swelling. Unfortunately, the effects wear off soon after the needles are removed, oftentimes after a day or two. And at $60 to $120 per treatment, this could be quite expensive. To understand why acupuncture is not very effective, we must understand carpal tunnel syndrome. It's actually a disease that begins deep inside the wrist, inside a confined area known as the carpal tunnel. Inside the carpal tunnel, your flexor tendons, here shown in white, are very close to the median nerve, here shown in yellow. The tendons are surrounded by a fluid-filled sheath, here shown in blue. Under certain conditions, like rapid or forceful hand movements, that sheath can become damaged, causing microscopic rips in them, which naturally repair, but then rip again. The cycle of rip and repair can happen hundreds of times, and in time, the repeated rip and repair process causes adhesions to form. These adhesions make it difficult for tendons to work properly. The body reacts to the adhesions by producing inflammation and swelling of the sheath. As the sheath swells, it pushes against the median nerve and compresses it. And that nerve compression is what causes all of the symptoms of carpal tunnel syndrome. It's important to know that for any remedy to be effective and lasting, it must break up the adhesions and not just take pressure off the median nerve. If the adhesions are not eliminated, then inflammation and swelling will reoccur again once the hand is used excessively. In some people, acupuncture needles can reduce swelling and even deaden nerve endings, but the effect is only temporary. So if acupuncture is only temporary, and you do have carpal tunnel syndrome, what else can you do that's effective and permanent? If you're one of the millions who have carpal tunnel syndrome, it's important to note that carpal tunnel surgery does nothing to solve this problem of adhesions and inflammation. Thus, surgery is not the way to get rid of your pain and other symptoms. Studies show that most people who do have the surgery don't need it. And when they do have surgery, the majority of patients are unsatisfied with their results, because surgery doesn't prevent tendons from swelling once again. In contrast, most people using non-surgical therapies are quite satisfied with their results. So what is the best way to eliminate inflammation by removing the adhesions on the tendons? Most people get complete and lasting relief using deep tissue massage therapy. But this isn't your ordinary massage. Pressures are directed outward from your wrist with every circular motion. The longitudinal component of this motion drains fluid away from the carpal tunnel, while the lateral component of this motion breaks the adhesions around tendons. Most importantly, to be effective, this deep tissue massage must be performed daily and for 2 to 4 weeks, otherwise it won't alleviate symptoms. Thanks to a new technology, you don't have to see a therapist every day to get this treatment. This technology is the amazing Carpal Rx. It's like a take-home therapist, where you put it on your forearm twice a day for 15 minutes. It's carefully calibrated to produce the same motions, speed, and pressures that a therapist uses when performing deep tissue massage on your wrist and forearm. And it's so simple to use. Just plug it in, slide it on, strap it in, and relax. The Carpal Rx will do all the complex deep tissue massage for you. So throw away all those splints and braces that just don't work. And don't even think about having surgery. If you have carpal tunnel syndrome, wrist tendonitis, or repetitive strain injury, you owe it to yourself to try this remarkable product. The Carpal Rx always comes with a 60-day free trial, so if you're not completely satisfied, return it for a complete refund of all of your money, including your shipping costs. The Carpal Rx is guaranteed to get rid of all of your symptoms, and it will do it easily, completely, comfortably, and cost-effectively. Remember, it's completely guaranteed to work for you. Learn more at carpalrx.com.